25 to 30 degrees. That's the normal body temperature of a man. So that incubator mimic the temperature of the woman body. After some days, after a period of like 5 days, after collecting the sperm and the woman's egg, fused together in a tube and stored in an incubator, normally in a single ejaculation of the sperm, it normally consists of 300 million cells, sperm cells, in a single ejaculation. So the sperm cells in the semen of the man collected and the human egg will fuse together inside that tube. After fusing together, they will form what is called an embryo or zygote, anyhow you call it. After fusing together, I'm explaining in vitro fertilization. The woman is going to come back after some days to the hospital, and the doctor is going to insert that embryo or that zygote into her womb. After inserting it, then they will monitor her for a period of 4 to 6 weeks. After monitoring, then pregnancy test strip now. She will use the strip and check her urine whether she is pregnant after 4 weeks or 6 weeks. If she is pregnant, then the in vitro fertilization is successful. If she is not, then you try again. This is in vitro fertilization. While surrogacy is some women have reached to their menopause and can no longer give birth. If that is the case, you can no longer give birth, but you have eggs in you. Then you go to the hospital and complain to the doctor that you have reached of age, but you want to have a child. If you complain to that doctor with your husband, they are going to collect a sample of the husband's sperm and a sample of the wife's egg and fuse it together in a test tube again, stored in an incubator for a period of 5 days. After 5 days, they will come and check whether they fuse together, whether they fertilize to form the embryo. If it's successfully fertilized, then the embryo is going to be transferred, not to you, because you have reached of age. I'm talking of women that can no longer give birth due to either removal of the uterus or some reasons. Then they are going to find a woman. They call that woman surrogate.
Surrogate mother.
It's a business. They normally conduct it in Abuja, Lagos, Rivers, Delta. The women are there to take the pregnancy for you. They are going to insert that egg, the embryo, into the woman's womb. And the woman will bear the consequence of that 9 months of pregnancy. After 9 months, you will deliver the child and give it to the parents. This is what they call surrogacy. Do you understand? So, the success rate of in vitro fertilization, normally, if you suffer the problem of infertility and went to your doctor, the first step they take is in vitro fertilization. If it fails, then you move to surrogacy. Surrogacy is an option for in vitro fertilization. And as I have said, the causes of IVF, in vitro fertilization. What causes a woman to perform that procedure, IVF? Among the reasons is, as I said earlier, blocked or damaged fallopian tube. You know, fallopian tube is normally the tube in the woman that carries the egg to the uterus. It's just like a vehicle transporting goods from, let's say, Lagos to Abuja. Fallopian tube is like a vehicle that takes the egg from where it is developed or produced to the womb. So when that fallopian tube is damaged, then it calls for in vitro fertilization. And among some reasons of what causes couples to undergo IVF, in vitro fertilization, is low sperm count. You know, some men are suffering with the problem of low sperm count. If the number of a sperm cell in a semen is not up to 3 million per ejaculation, it will be difficult for a man to get a woman pregnant. So among the reasons that calls for IVF is low sperm count. And alongside the surrogacy and in vitro fertilization, there is what they call intrauterine insemination. This one, they will not remove the egg of the wife. This one, only this, they will find a catheter or a tube, something like syringe. That syringe will consist the man's sperm, and it's going to be inserted into a woman's cervix. They will inject the sperm to the woman, and they will monitor it for a period of 14 days, after which they will check whether she is pregnant. But this one is less invasive and less inexpensive than in vitro fertilization and surrogacy. If you don't have the money to undergo IVF, in vitro fertilization, or you don't have the money to undergo surrogacy to make a woman carry your child for 9 months, but in Islam, surrogacy is haram. Islam does not welcome or appreciate the idea of surrogacy. يَهَبُ لِمَنْ يَشَاءُ إِنَاثًا وَيَهَبُ لِمَنْ يَشَاءُ الذُّكُورَ أَوْ يُزَوِّجُهُمْ ذُكْرَانًا وَإِنَاثًا وَيَجْعَلُ لِمَنْ يَشَاءُ عَقِيمًا. So, if Allah has given you the opportunity has given you a fertile womb to be able to give birth to, Alhamdulillah. If not, you can undergo IVF. If the IVF fails, then you take it as a decree. So, let's know the price now for IVF. I know most of you have had the IVF. Then how much does this cost? This IVF, they do it in Makodi here. This Benue University Teaching Hospital, yes, they do IVF there. So anyone wishing to partake the procedure can go to Benue State University Teaching Hospital. The price of this IVF is around 2.3 to 2.7 million. This is when 2.3 to 2.7 million. This is only when you are giving your sperm and your wife egg. If you know, there are instances where they will collect the egg of the wife, but they will face a problem with the sperm of the husband. In that case, you need a donor sperm. That is, someone is going to donate his sperm to mix with your wife's egg. If that is the case, it is around 2.9 million if someone is donating his sperm. Likewise, if you have a very successful sperm count and the egg of your wife happen to have some impairment, then you need a donor egg. That donor egg too will cost you 2.9 million. This is for IVF. There is what they call semen freezing. You know, normally, as I said, when a man ejaculates, that water is called semen. Inside this water contains sperm cells, millions of sperm cells. So if you are giving your sperm to, like, let's say you are donating your sperm, then that sperm will need to be freeze so as not to make the cells in the sperm die off. The freezing of the sperm causes 162,000. That one, no cost. And there is freezing of the egg too. If a woman is giving the egg, but you know, normally if things relating to, let's say, heart, you know, heart has pulse. You know, everything in your body has pulse. You know pulse? With some pulse like if you hold your hand, you feel something like something is beating. Yeah, that is called pulse. So normally everything in your body, the heart, the kidney, the liver, all have this pulse. But to make it viable meaning to make it lively, you must freeze it. So the egg too is froze, and the freezing of the egg too costs 780,000. Then coming back to surrogacy, if a woman is to carry your pregnancy, how much will it cost? It costs 1 to 2 million. This is only the procedure without medication. There are additional costs of drugs and treatment, but only the procedure costs 1 to 2 million. I believe if I stop here, you all understand what I just explained. Thank you and God bless you. Wassalamu alaikum.